common presentation of an adolescent, roughly age 8 to 14, to a foot and ankle surgeon is that of heel pain. Oftentimes the child or the parent will comment that the patient has had significant pain on the backside of the heel near the Achilles tendon attachment for a certain period of time. There may or may not be swelling. There usually is no direct traumatic event. Oftentimes these children will be active athletically. Oftentimes we see this at the initiation of a sport or at the beginning of a sport season as the child gets back into conditioning. Essentially, Sever's apophysitis or calcaneal apophysitis is inflammation of the growth center. There is a growth center at the backside of the heel at the Achilles insertion which becomes inflamed and aggravated, and even can in some circumstances have microfracturing. Essentially this is a friction problem. The Achilles tendon, which comes down the back of the leg and attaches to the back of the heel, attaches to the growth center and causes a shearing or friction injury to the main body of the heel. This can be quite debilitating and can be quite painful. Treatment is usually anti-inflammatory medications, icing, a good stretching program to try to lengthen the Achilles tendon, as that is the underlying etiology in most cases. We will also recommend utilization of a heel lift to attempt to take tension off of the Achilles tendon. Oftentimes this initial treatment works and resolves the problem. It does seem as though some of these adolescent patients and young children are prone to this problem and will often develop it bilaterally or have recurrence of the problem at the initiation of each subsequent sports season. If conservative treatment or initial conservative treatment is not fruitful, cast immobilization and limitation of sports activities is often required and often is successful.